Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, to bolster frontline staff, operators open up their own CNA schools, graduating thousands. In the nursing home sector, building a frontline workforce has become more crucial than ever, especially as the industry grapples with the federal minimum staffing mandate. However, CMPs can halt in-house training programs if a facility is cited, stretching an already thin staff and increasing burnout. To combat, some operators are taking innovative approaches. Alabama-based Schmidt-Wallace Healthcare, a small regional operator, has created its own nursing school to produce CNAs, graduating up to 1,000 CNAs annually, ensuring a steady flow of trained staff. Meanwhile, major educational institutions like Chamberlain University in Illinois are also stepping up, integrating practical co-curricular courses in their nursing programs. Funded by a $1.2 million grant, this initiative places students in real-world care settings, including nursing homes, to better prepare them for the workforce. Chamberlain's goal is to reduce turnover and match students with the right work environments, a move that could save millions in healthcare costs. The push for homegrown CNAs, especially in underserved areas, is seen as a long-term solution to staffing shortages. These educational efforts by both are expanding the talent pool, benefiting not just their own facilities, but entire communities. Next, the average LTC nurse shift rises to 10.5 hours, Alaska and Utah working the longest. LTC RNs in Alaska and Utah are clocking some of the longest hours in the country, with an average shift lasting 11.9 hours in Alaska and 11.8 hours in Utah. Nurses face heightened risks of burnout and fatigue. Nationwide, the average shift for nursing home RNs has increased to 10.5 hours in 2024, up from 10 hours in 2021. 12 states, including Kentucky, Montana, and Nevada, also reported average shifts of 11 hours or more. In contrast, nurses in states like California, Pennsylvania, and Wisconsin are working shorter shifts, averaging less than 10 hours. The report highlights that states with large rural areas are struggling to distribute their workforce evenly. Utah, for example, has fewer than 7 nurses per 1,000 residents, with nearly 3,000 vacant nursing positions. Alaska faces an even more dire nursing shortage, with over 1,500 RN vacancies and a number that is expected to surge to 5,000 by 2030. In response, Alaska recently passed a law allowing lapsed licensed nurses to work under temporary permits, speeding up their return to the workforce. Nationwide, the nursing home sector is grappling with ongoing staffing shortages. Prolonged work hours and fewer staff can lead to increased fatigue and mistakes, directly affecting patient care. As demand for LTC rises, experts warn burnout among nurses could compromise the quality of care for our aging population. And lastly, CLA breaks down impact of higher penalties, payment changes, and 2024 trends for nursing homes. Nursing homes could face significant financial impacts due to new enforcement policies included in the recently finalized SNF PPS. Expanded CMPs could cost nursing homes an additional $25 million annually, with federal and state agencies incurring $164,000 in administrative costs each year. The updates to VBP are also expected to reduce aggregate payments to facilities by approximately $187 million in 2025. Data collection modifications to the QRP will add another $2 million in costs annually starting in 2027. Several key measures, including nursing staff turnover and HAIs, will start being scored in 2026. CMS has redefined instance of noncompliance, allowing multiple penalties within the same survey if a facility fails to meet participation requirements, meaning CMS can impose per-day penalties up to $10,000 and per-instance penalties ranging from $1,000 to $10,000, or both, for each occurrence of noncompliance. Looking ahead, several trends will shape the nursing home industry in 2024. These include a positive momentum in occupancy rates driven by increasing demand, ongoing mergers and acquisitions, and persistent workforce challenges. Providers are also focusing on health and wellness offerings tailored to specific markets as part of a maturing vertical growth strategy. As facilities navigate these changes, the financial and operational landscape for nursing homes is expected to become increasingly complex. Thank you for joining me for News This Week in Nursing Homes. To get more of QSource news and info, visit qsource.org. To view podcasts, sign up for the newsletter, and remember, For all of your QI needs, call the Q.